Hi, one and all. The latest IDF data reveals that 1 in 7 diabetics worldwide is from India, and also that we have a staggering 74.2 million diabetics in India. To throw more light on recent advances in the field, we have with us a renowned physician from Aurangabad. We have with us Dr. Indurkar. Welcome, Dr. Indurkar.
Thank you.
Dr. Indurkar, how relevant is glycemic variability in your clinical practice? And how does glycemic variability impact uh, a patient's journey, be it from the morbidity or the mortality perspective?
I remember about 10 years back, we were not very conversant with AGP CGMS. And there were many patients who were just uncontrolled in spite of all possible efforts at that time. But in last decade or so, with the advent of these two wonderful gadgets, the phenomena of glycemic variability has picked up regularly, very commonly, and routinely in our patients. And when we started thinking how it is going to reflect in patients' outcome in the form of morbidity and mortality, it is very clear that the basic stimulus for oxidative stress is glycemic variability. Every damage happening to epithelium, endothelium, entire vascular tree is because of all those ups and downs happening in glucose levels, that is glycemic variation. And their importance is beyond doubt as it stands today. Coming down to morbidity, we are well aware that microvascular and macrovascular complications are pretty common right at the time of diagnosis in type 2 diabetes. And we have majority of type 2 diabetics coming in to our OPD with either neuropathy, retinopathy, nephropathy. And we wonder that how we can help them. One of the tools which we'll have is bringing down fasting, post meal, and A1C to normalcy. But when it comes to glycemic variability, which is probably an unmet need couple of days back, couple of years back, now it is well addressed, well managed, and we see that properly controlled patients where no glycemic variability happens, the risk of developing complications, the issue of tackling complications which happen regularly, routinely, are definitely under coming control, and their prevalence, incidence, and a symptomatic presentation is going down. When we talk of mortality, which is obviously majorly because of cardiovascular issues, we know that cardiovascular death is very common early, and the disease is very severe in type 2 diabetics. And I'm sure as we pass on, look more and more data in our real world clinic, the problem would be understood at individual level very well, but the data clearly pinpoints that glycemic variability is going to make a very positive impact as far as mortality is concerned, mainly because of cardiovascular insults. That's what I would like to talk about these two issues.
Dr. Indurkar points very well taken. Various studies like the Optima study, the TEDdy study, etc., have shown a reduction in glycemic variability with DPP4 inhibitors. How does this evidence impact patient care?
DPP4 inhibitors are most popular, widely used, safest, and convenient antidiabetics at the hands with a new entrant in clinical practice, people who are mature practicing diabetology for years together, and all those who are doing super specialty related to metabolic diseases. And as you rightly said, the data with these two studies and many more other studies with n number of patients recruited, practically every DPP4 inhibitor tested, it has come out strongly, positively suggesting that glycemic variability is very well taken care of by DPP4 inhibitors, and the results are satisfactory, encouraging, and positive for most of our patients.
Thank you, sir. The latest ADA 2022 guidelines, they have taken a more broad stance as far as the first line therapy is concerned. In clinical practice, are there any subsets in your patients, purely from a clinical practice perspective, who might benefit purely from DPP4 inhibitors as the first line of therapy?
Definitely, as I suggested in the earlier question, that it is one of the safest, effective, confident therapeutic agent and which is playing wonderful role in managing hyperglycemias. Coming down to a real clinical experience, there was a time when we had only metformin, sulfonylurea. On the top of it, later in last century came pioglitazone. All the time we were missing that, oh, something is not probably going according to our expectation. And at that point of time, the DPP4 inhibitors came in. And the major difference which we felt was they were so smooth that when we were adding it to ongoing metformin sulfonylurea combination, the fine tuning which was required was smoothly done with DPP4 inhibitors with practically no hypoglycemias, no glycemic variations, and patients maintained their glycemic stability without glycemic variation for years together. And I think I salute DPP4 inhibitors for such a wonderful contribution in our clinical management and patients' glycemic stability.
Thank you, Dr. Indurkar. Vildagliptin, uh, a previously twice daily DPP4 inhibitor, a BD DPP4 inhibitor, is now available as a sustained release once daily formulation. Purely from a clinical experience standpoint, how effective and safe is it in your clinical practice compared to the standard formulation?
Vildagliptin was one of the most popular, widely used, available Vilda in 50 milligram BID dosage right from about 10 years plus. We were using it comfortably with twice a day dose. The day it was available in India in 100 milligram once a day release pattern, we took a back. We thought, oh, this is something uh, unlikely. It's probably not going to work. But the day we started using 100 milligram OD in our patients, it's almost 4 to 5 months. The benefits were single day dose, compliance, adherence improved. And as far as clinical outcome, glycemic parameters, glycemic variability was absolutely comparable with 50 milligram BID dosages. And most important, the convenience which we offered to our patient led to better compliance, and the therapy with 100 milligram OD with vildagliptin, I think, stood test of the time. It has overcome all the lacunae and drawbacks, and I fully endorse that this wonderful 100 milligram OD preparation of vildagliptin should be used in every patient to give complete, total clinical glycemic benefit to the patient.
What are the advantages in clinical practice, Dr. Indurkar, that you would see by combining an SGLT2 inhibitor with a DPP4 inhibitor?
I think if you look back last 5 to 10 years, these are the two top molecules which have been introduced, picked up by all clinicians, have benefited patients nicely. And when two top used molecules are combined together, there are two obvious outcomes that they are probably going to have a synergistic additive benefit. We well know that SGLT2 inhibitors have tremendous benefits over cardio-renal metabolic outcomes. The data itself suggests, gives evidence. On other side, DPP4 inhibitors are one of the safest, effective, smooth anti-diabetic with practically no bar or very minimal contraindications or restrictions of the use. And if you look at the side effect profile of SGLT2 inhibitor, where the limiting factor is mycotic genital infections and urinary tract infections. And it has been observed in many studies when we combine DPP4 and SGLT2 inhibitor together, the prevalence, the incidence of these mycotic and urinary tract infections go down significantly. And I'm very happy to say that the day we started using them together, the fear in our minds about mycotic infections and the worries in minds of our patients about both urinary and mycotic infections have gone down. And I would say this is one of the best combination in last decade where clinical adverse events wise and long-term benefits like cardiometabolic, cardiorenal protection is wonderful. So this combination is one of the top available, used and beneficial combination.
Thank you so much for your time, Dr. Indurkar. It was a very enriching exchange on certain newer aspects of diabetes, which would be of huge benefit to the audience. On that note, we thank Dr. Indurkar for his clinical insights. Till next time, stay safe. Goodbye. Take care.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.